good afternoon, or good evening, and welcome back to Bariatrics and Beyond, the podcast where we talk about life before, during, and beyond bariatric surgery. So pull up a seat, grab yourself a drink and a healthy snack, because today we have Mr. Magic Hands himself, our chief head surgeon, Dr. Omar Lazos.
Hey, how are you?
Good. How are you?
I'm good. Just got out of surgery and very happy to be here with you.
Well, thank you for joining us. I know how busy you are and how many, bodies you're changing daily. So we appreciate your time.
Well, thank you so much. You never bother me. It's a pleasure to help others on their journey. That's the main reason of the podcast and of the Facebook groups and Instagram, because we want to have you to join us and be smooth as possible on your weight loss or plastic surgery journey.
Yep, perfect. So with that being said, let the viewers get to know you. So tell us all about yourself. Just, where you're from, how old are you, when did you, decide plastic surgery was for you, all that kind of fun stuff.
Okay, let's just break everything up together. Okay, My name is Omar Lazos. I was born and raised here in TJ. Most people do not get born here. People are always coming here to this city as like migrants. A lot of stuff. So I'm one of the first maybe generations that are from here. I was born in 1982, so make the math. I'm 42, almost 43 years old. I hope that I don't look 40.
No, but okay. You know a guy that can,
Well, I only do skincare and Botox. That's the only thing. Oh no, I rest and sleep by 8 hours.
You guys, Dr. Lazos does his own Botox. He just goes.
Yeah, I do it on my.
I love that.
It's common in plastic surgery.
Oh, of course.
And when you say, guess what? I'm a plastic surgeon. And yes, I do my own Botox. And yes, I do.
Oh, I wish.
Well, I studied medical school. It took me 7 years of medical school. Then afterwards, I did a specialty on general surgery in Guadalajara, Mexico. It was 4 years. So now they're 11 years, plus 4 more years of plastic surgery in Mexico City. So that gives us a total of 15 years to get to be a plastic surgery from scratch.
That is crazy. We were talking to Dr. Ortiz, and he was telling us the same sort of thing. Like, you guys have to go through, general surgeons.
Actually, Dr. Ortiz and I went to medical school, to the same school, but we never met. Actually, we met in Guadalajara. I think it was a thing that had to be done, destiny, I don't know. And there is where we met. We were fellow residents of the same year in Guadalajara for general surgery. But he went to the bariatric side, and I was very stubborn, and I went to the plastic side. So I kept on moving and studying more the 4 years to become a plastic surgeon. That's how I met Dr. O.
I find it hard to believe that you're very stubborn. Just kidding. So
you just have to get done what you need to get done.
That's true. That's true. Absolutely. So
get in the middle.
That's it. So why plastic surgery? What was it that triggered you to think you know what? I want to be a plastic surgeon. What was that?
Okay, this wasn't overnight. I don't know why. I mean, I knew I wanted to be a doctor in high school. Mm-hmm. And then it was to show the Swan that I saw the transformations. And I said, oh, now that I know that I want to be a doctor, but I want to be that. I want to change, transform people's lives, bodies, to make them feel better. And why weight loss patients? Well, in the process of me being a medical student, I realized that bariatrics were starting in TJ with the lap band. Back then, it was the lap band. Now it evolved to the bypass, to the sleeve, to whatever stuff. And I said, okay, that is what I want to do. I want to do the aftermath when people lose weight, and I want to get them to look as best as possible that we can with what we have. And that's the rest of this history. That's what we're doing all this almost 7 years, because I've been a plastic surgeon since 2016. So it's been 7 years now, almost 10.
That's so cool. And that's what I love about you and the EOC Plastics crew, is that you guys specialize in us massive weight loss patients, because there are plenty of plastic surgeons out there, but not everyone has that skill and that expertise. You guys are artists, like the way you can actually transform our bodies. So what's the difference between just, regular tummy tucks and, removing and contouring somebody's body that's lost, say, like 200 pounds? Like, what's the difference?
Okay, there is a lot of difference. For example, when they get like a regular plastic surgery patient and they do a tummy tuck, it's a breeze. Oh my God, it's just so easy and it turns out well. But when you have a weight loss patient done with a sleeve or a bypass, there's a lot of changes in their bodies. Number one, the skin has poor quality. It's not elastic. You have to deal with tons of redundant skin. You have to make it symmetrical. You have to make it even. Also, you have to give a shape, because we're not just skin removal surgeons. We also do aesthetic in the reconstruction of the bodies. So that's something people really appreciate because, for example, I don't know, in Canada or in the US, your insurance covers a panniculectomy, the penny, but it's not aesthetic. They take away your belly button, and maybe you won't even fit or qualify by BMI to do that, but it's just insurance, so they will not take care of any aesthetic thing on your procedures. And then they come to us, and I have to fix it, and it's way more difficult than if you did it the first time with us. So that's another thing. Nutritional status is not the same. Even if you take your supplements, it's very hard for people to get, for example, their hemoglobin up to 13 or above, so we can do elective surgery on them. And also that it's really difficult. It's not really easy. So we also try to make the patients realize that they have to have realistic expectations on the results, okay? Because we work, and I swear to God, we try as hard as we can to give you the best result, but what you have. And everybody, it's very different. Everybody loses weight very differently. We have a lot of shapes, a lot of type of bodies, a lot of type of the skin is different in every part of the body, sounds in patient to patient. So we have to tailor and personalize each procedure and surgery. So there you go.
Yeah.
Body type, realistic expectations.
Yeah, that's what I was going to say. I think it is as good that you said realistic expectations, because I'm sure most people take in a picture of Kim Kardashian and they're like, I want to look like this. But you guys, did Kim Kardashian ever have, 100, 200 extra pounds? So it is.
And it sounds funny, but I get that a lot. I mean, they say, I don't want a Kardashian butt. For example, I don't want a Kardashian butt. Or I don't want to look like Kim Kardashian. I mean, not even if I could. I mean, you're not Kim Kardashian, because Kim Kardashian, I think she has never had that BMI,
Yeah.
So I would just have to work as much as possible what we have. Yeah. So that's why the page is for, to give you every day befores and afters, immediate post-up, so you can have an idea if that resembles your body, how you're going to look-ish. Okay?
Right. So if someone's watching this and let's just say they've just had weight loss surgery, can you explain kind of who is a good candidate for plastic surgery?
Okay. Well, I mean, we also take non-bariatrics plastic, but if you have or you've been plus size all the time, and you lost a lot of weight, the ideal, not because of me, because of journals, ideal BMI to avoid serious complications. Strictly, the journal said it's below 30 BMI. I give you one extra point, so 31. If they do the cutoff and they say it's fine, I will go above 31. But for now, it is what it is. And good candidates, you already lost the weight. You're in good shape. You have a good nutritional status. Let's say you had the sleeve done or the bypass. Usually they wait 8 months, 1 year to get plastics. And then we do the evaluation and we tell you what you need based on the virtual consultation.
Right. Because I think a lot of people go in and they're like, well, I know this was me. I was like, I just want my arms done. And then when I sent for my consult, you said, okay, well, you want your arms done, but what you actually need is blah, 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 blah. So in our heads, we might think, oh, we only just want this or that done, but you will tell us exactly what our body needs. And it's actually really interesting because even in my pre-op appointment with you, we were going backwards and forwards about the torsoplasty, which you guys is the back lift. And I was like, I don't want a torsoplasty. And you're like, look, I'm not telling you what to do. You said to me, your body is telling me what it needs. And then you grabbed my back and you went, and then he
Yeah.
dropped it. He dropped it and he goes, but it's up to you. And I was like, well, okay. So that's really interesting because I think in our heads, like we think, oh, we want this or we want boobs this size or, we want 500 cc's or whatever. But you tell us what our body will be able to take, which is really eye-opening, I guess. Because
Yeah, a lot of consultations, for example, said, I want lipo. And of course, you don't need lipo. You need the tummy tuck.
yeah,
Yeah, and if you don't are convinced about a procedure, for example, the torsoplasty, the back lift, I say, I'm going to show you in the mirror, see if your body tells you that you need it. And I simulate the surgery in front of you. And then you get convinced that you actually need it because I can do whatever you want, but optimal results only with incisions. I mean, I don't personally like to do unnecessary procedures or incisions, but we have to do what you have to do and you have to accept it. Scars are the price for being overweight, and we have to just deal with it. I mean, a lot of people will take 10,000 times before the scar than to keep the extra skin. So that's how we decide. Remember, the evaluation are suggestions. I cannot push you or decide for you. You have to be convinced that you want the procedure done. I suggest you decide.
Yes, I love that. I love that. So when it comes to the procedures, a lot of places, especially in the US, they will go, okay, well, we'll do your tummy tuck, come back for another round and we'll do your boobs, come back for another round, we'll do a BBL. But what I love about you guys is you do multiple procedures in one. So can you explain what's the most common combo that you do?
Okay. Well, it is wise for the US surgeons to go one step because I know it is very different, the health system than the US. Here, with experience, we can safely do 5 procedures in one stage without jeopardizing your safety. We do belt tummy tuck, that is the 360 tummy tuck, lipo, the BBL, that's the fat graft in the butt. We can do the back lift, and we can do an extended breast lift with or without implants. Those are 5 procedures in one that can be done safely in one stage. At a second stage, we usually do the limbs. We do arms and thighs.
Right. And so we get a few people asking, well, can you do my tummy and thighs together? Can you do that?
Okay, I did initially. I was a little bit naive because the patients they told me I can stand it, I can deal with it, and I saw that they really can't. I mean, it's just too much. It's very uncomfortable to have the thighs done with the tummy tuck, and also the tummy tuck itself lifts the upper thighs. You give it a chance to, and the second stage you can plan better the thigh lift. So that's why I do not recommend, and it's not comfortable to do thighs and tummy tuck at the same stage. I usually, and has worked very well for us. So that way the recovery is way easier, especially if you're on your own.
Yeah, right. Okay, so let's say someone's going in for the big five and they're doing all those procedures at once. What is the surgery time? How long does it take usually?
Well, back then when we started, it was like 8 hours.
Wow.
Yeah, when we started, you have to start it in something. And now we cut it to 4 to 5 hours, depending on the body type. So to be honest, 5 hours doing 5 procedures at once, it's a very, very good OR time. After 6 hours of OR time, the complications increase exponentially. So that's what we have to do, whatever we can and keep it under 6 hours of overtime.
That makes sense. Okay, so let's walk people through the process of plastic surgery. So you've hit your goal weight, you steady at a weight for a few months. You want to go for your consult. So they send in, they do a consultation, you tell them their recommendations, they book the
Uh,
surgery, then they come all the way to Tijuana. So they meet you before surgery, right? The day before?
One day before,
Mm-hmm.
because it's to break the ice a little bit,
Yep.
to like put your mind at ease.
Mm-hmm.
We check that everything is good, your lab work, your AKG. We do your surgical plan, and that's exactly what it is for. So you can see exactly what you're getting in the OR.
Yep.
Okay, and you're like the nerves like calm a little bit more, and you're more confident that you're getting exactly what you came for.
Yep. And then that's when you do all the markups and all the
In the
drawings
markings,
and
yeah,
the
the markings.
measurements and all that kind of stuff. And then the next day is surgery day, correct?
The day surgery day, you arrive here early at the hospital. You get admitted, you get the IV on, you get all the signatures, whatever. At like 9 a.m., yeah, we're starting surgery.
Right. And then they stay in the hospital that night, correct?
One
Perfect.
day, you leave on the next day when you get all checked out, your lab work, that everything's fine, so you can go safely back to the hotel.
And then recover at the hotel. So let's talk about recovery. How long um, for like a mommy makeover? What is the recovery time?
Okay, here at the TJ, you have to stay 5 days post-op because you need your 5 mandatory massages. And also, I have to see you at the 5th day to give you a green light to go back home so you can fly or drive safely back home. But the downtime, I always tell my patients when you're getting a big procedure done or just a tummy tuck itself, 6 to 8 weeks. That's like a safe time for you to go back, for example, to work or to start doing exercise. That's like my magic number between 6 and 8 weeks if you don't get any complications.
Right. So let's talk about complications. What kind of complications can happen and what's the best way to avoid a complication after plastic surgery?
Okay, the most common complications are wound openings. And why does that happen? Because after the second week, you start feeling better and better,
Mhm.
and you start doing more stuff, and then you start pulling and stretching. But the wounds are very delicate; they're still healing, and they're actually at the second and third week they're very like weak, and they just get open if you do like one movement that you like didn't even like meant to do.
Mm.
So my best advice is for you to give yourself after you leave TJ, give yourself at least 3 weeks to basically do nothing then recover at home. It's very difficult because people just want to do stuff, and I understand that.
Mhm.
I'm also very hyperactive, but that's my best advice: to keep the wounds clean and dry, to basically do anything, nothing at home, and eat well so you have enough protein
Mhm.
so you can heal up. So
Perfect.
that's my main advice.
Right.
Follow your doctor's orders.
Doctor's orders. Now let's talk about the Fajah, right? So after surgery, the next day, you get put into your Fajah and that's it. Um,
Yeah,
can you explain why the Fajah is important? And how long do you have to wear it for?
Faja for us is very important. You guys say Faja, it's Faja.
The Fajah.
The Fajah. Okay, why the compression garment? Well, you create a lot of dead spaces when you do surgery with lipo, with tummy tuck. So one of the purpose of the faja is to stick the skin back to your body, to like don't get the dead space because those dead spaces get filled with fluid. So it stops you from getting swollen or limits it and also shapes your body.
Mm.
So when people go out of their faja, they feel like very like insecure. I don't know. They say like a very like weird feeling that they need something, and the compression does help a lot. And that's the main reason why we ask you guys to stay in the faja for at least 2 months, 8 weeks.
Is that 24 hours a day? Well, I mean, obviously you could take
24
it.
hours a day, except when you get the massages, obviously.
Okay, so massages, let's talk about that. So while they're recovering at the hotel, We do have massage therapists that come around. Maripaz, she's amazing.
Yeah.
And so
You have an amazing lymphatic therapist. She has more than 15 years of experience, and she does this every single day. So those are another eyes for me, because if she sees something that it's wrong, immediately she calls me, and also the nurses at the hotel call me, and that's why we need somebody who knows how to do the lymphatic drainage massage, not just any masseuse.
So when the patient returns home, you do recommend to continue getting lymphatic drainage massages, don't you? And for how
Okay,
long?
the reason that I advise you, if you can pay for them, is because you still get building fluid. Okay, your body, because of inflammation, you get a lot of fluid. You get very swollen, and that's the normal response of your body to an aggression. You had a surgical aggression. So if that way everybody has the massages and they milk everything through the drain inside out, you will avoid swelling and seromas. Also, seromas are accumulation of fluid inside your dead space. For example, the most common part is the tummy, and it goes down by gravity and it stuck there in the lower pubis. So sometimes you get a bulge there, and it's two components, or a fluid inside the dead space or in the tissues themselves, and it looks like a bulge, and it usually goes away in 6 to 8 months. So, but if you can afford to do the massages every single day at home until the drain comes out, and afterwards to complete 1 month, it's way even better. I've seen you do way better doing massages for 1 full month. If you can, try at least to get 3 massages a week.
Right. Okay, so you were talking about the drain. Can you explain to us the purpose of the drain, and how long does the drain have to stay in for, and then who takes it out?
Okay. The purpose of the drain is to not get seromas. What I told you was feel accumulated inside your body. This is from the beginning, since it has to be at least 2 to 3 weeks. Now I'm telling everybody 3 weeks. You have to take it out in the States. You cannot stay 3 weeks here. It's too much. And it's also mentally not good for you. You need to go back home.
Yeah.
Okay. So you can talk to your PCP before you come here. You can talk to a nurse friend, or in last resources, just do it yourself. There's a video or videos on the Facebook page. How can you put it out yourself? I know it sounds crazy, but a lot of people have managed to do it on their own.
I think it's more mind over matter thing. You think about it, and
it does not hurt.
No, you don't. You actually don't feel it. It's held in just by a little stitch. So you just clip your stitch and then take a deep breath and basically
you
pull
remove the stitch and you just pull it out. No mercy.
Yeah, it's pretty easy. I think definitely a mind over matter thing. All right, so let's move on to BBLs and Boppies. So, can you explain to people how to maintain a BBL, and how long, and what is a Boppy? How long do they need to use a Boppy for?
Okay, BBL, everybody wants a booty. The gluteal fat graft or gluteal fat injections, also called as BBL, Brazilian butt lift. I don't know who gave it that marketing name. It's a procedure that involves the fat grafting in the butt. So by rule, by the books, 30% of the fat graft goes away. Okay, and the other, we try to keep it there by avoiding pressure to the fat cells that are grafted. So the fat intake into the new site takes 4 weeks. So that's why we advise to do the Boppy pillow for at least 4 weeks. Okay, that is the purpose and why the rationale. And it has worked for us. Okay, some plastic surgeons, I don't think they don't even use it, but trust me, if you sit on a flat surface, the BBL will go away.
Yeah. So you take your Boppy pillow everywhere with you. You just, if you go into the office, you got to sit on it.
Even though you use a Boppy pillow, you will lose some fat. Okay. We try that you lose as less fat as possible to keep your booty.
Yeah, exactly. Okay. So Dr. Lazos, we have the EOC Plastics team. It started a solo mission. It was just you. And then your results were phenomenal. We were doing more bariatric surgeries. people were like, well, I want to be a Lazos doll. Everyone wanted to be a Lazos doll. That's what everyone called themselves. And then you got insanely busy. And then you thought, well, we need another plastic surgeon. And then another and another. And it's just the plastic surgery team has multiplied. So can you explain who are the plastic surgeons at VOC? And you are the chief head surgeon. So how did you handpick who the team was going to be?
Okay, it was starting. It was not easy. It was not easy because, uh, um, like you said before, there's not a lot of plastic surgeons who do specialty in weight loss. Actually, it does not actually exist as such that I'm gonna go and take a 1 year course to specialize in weight loss binges. No, it doesn't exist. So we have to start it basically from scratch. We had what it was done before in the journals of plastic surgery and all over the world, and we started to improving the results until we got it as right as we can, as best as we can for the patient. And that's how we got better and better. But thank God, we had a lot of patients, and I needed vacation, so we needed more plastic surgeons. So I did handpick because every like Dr. Ochoa, Dr. Leiva, Nico, Dr. Rios, each one came and visited me, and I just like, he has potential. Okay, let's test him. And then I invited them to help me for 1 full year every single day in surgery. So they also learned how to do this by themselves. So each surgeon was with me 1 year doing the procedures. So that way they were very familiar and they know how to do weight loss patients. So that's the story behind it.
That's
Of
so
course, you
cool.
get better and better when you do it more. The learning curve gets better and better,
Yeah.
and the results improve. Complications are less. And there's always a learning curve, but right now, I think the four of us have an excellent learning curve, and we have very few complications.
Yeah, that's incredible. Because we see on the Facebook page all the time, like, oh, how did you choose your surgeon, and who do I pick, and which one's the best? And the thing is, everyone's work is so comparable, and that makes sense because they all, were trained by you, so everyone kind of has the same sort of, aesthetics. But I think everyone's got their own little
Of course,
things.
everybody has
Mhm.
everybody has their own touch, but that's what kind of like the condition that we ask them, that they have to resemble my results or
Yes.
improve them for
Mhm.
sure,
Mhm.
because why not? Or in giving their touch. But that was the thing because people were looking for my results, and
Yeah.
I can be another surgeon who will not give you something similar or better, you know? So that's how everybody got their touch. Uh, Everybody's different. I don't expect them to be exactly like my results, but I think they are really good. The three of them doing the weight loss patients. You can trust whoever you want.
Yeah. Okay. So, Dr. Lazos, we have a lot of resources online, but our main resource is the Facebook support group. So, can you talk us through the support group and what to kind of look for in there?
Yeah, I have my own support group. That's how we started at EOC. But then when the other surgeons, also the facial surgeons, came in, we needed a group that had everybody in. So that's why we created the EOC Plastics. And I also have my own page. But let's talk about only the EOC Plastics. And when the EOC Plastics group, the main thing is educational, educating yourself from A to Z. Like, you wanted to say, okay, hold on. Before you decide, make your research. Here's the page. You have the resources. You have the feature tab that has some tons of information. And that has worked very well because people here come here having a big idea of everything that can happen. What is recovery, possible complications. We post results every day, so you can like find your body type and say, oh, I can like look like this result. So education for us has been power, and also education lowers complications and lowers risk because you know that it's for your own good and you know what to do in case if something happens, you know?
Right. So
That's the purpose of the group, and also to know each other, to know the results, so you can decide who like you want to do your surgery with, all that stuff. And also you have the coordinators here that you can just reach out, and they're going to help always.
right. So what do you think some of the common fears about having plastic surgery are?
They're coming to Mexico.
So you think the biggest fear is that they come to Mexico to have surgery?
One of the biggest fears, yes.
Yeah. So how would you what's your advice to people who are like, don't go to Mexico for plastic surgery?
Yeah. I mean, of course, you're going to another country. If I was going to have surgery in another country, of course, I will make my research before and know exactly what's going on and experience of others. And of course, it's totally like valid. So that's why we have the support group. And there's phony surgeons all over the world, even in the United States. I mean, I have heard like horror stories from Florida, for example.
Yeah.
And it is what it is. I think, or for Turkey, so you're going to have good plastic surgeons anywhere, bad plastic surgeons anywhere, or phony plastic surgeons anywhere. So you just have to choose wisely in just research.
So
Okay?
what are some tips about researching a good plastic surgeon? What should people be looking for?
Okay, number one, they have to be board certified. Each country has its own board. You have to search for the board of your country that you're going to have surgery and see that that surgeon is actually in that board. That's number one. And sometimes, for example, me, I have other like memberships. I'm not exactly a plastic surgeon from the United States, but for example, I am a member, an international member of the ASPS, the American Society of Plastic Surgery. I'm also a member of ISAPS, the International Society of Plastic Surgery. So that way you have valid credentials of your specialty that helps you decide that this doctor, he has all the credentials, so you can be safe with him, you know?
Yep, correct. So what are some common objections to getting plastic surgery?
Objections? Let's see. Well, maybe they think that it's going to hurt. Maybe they think that they could like have any potential complication, or maybe the results. All of those together can be, yeah.
Okay, so you said it's going to hurt. Let's talk about the pain. What on a 1 to 10, do you think plastic surgery is painful? I've had it, and I look at all the incisions and all the places you've been cut and sewn, and I'm like, this is going to be awful. And I was gearing up for the worst. And let me tell you, I didn't think it's painful, like at all. I think it was uncomfortable because you swell a bit, but I don't think it's a painful process. So what are your tips on people that are worried about the pain?
Okay. Pain tolerance is very variable from patient.
That's true.
I have had the two opposite, that it's breeze, like nothing happened, and the other one that they're like, oh, this is so painful. I'm so miserable in pain. So for that, I always tell everybody, plastic surgery is painful. Yes, it is. If it's not, it's better, right? So that way you can expect worse, and if it's not, even better for you. What mainly hurts about plastic surgery, it's liposuction. Even if you didn't have any incisions, for example, and you just do lipo, it will definitely hurt. The incisions by themselves do not hurt at all. Okay, so there you have it. It's really from patient to patient. People mostly describe it as uncomfortable, but I get some patients that they do say it's very painful, but mostly it's bearable, and they do not regret doing it.
Right. And can we talk about the stitches? So if you are having all those procedures, where are the external stitches? When do they need to come out, and all that kind of thing? And where would they be?
Well, it's variable. For example, Dr. Ochoa does not leave sutures on the back part, but I do. It just my mind it eats a little bit more. But external sutures are visible, are nylon, are black, and are on the torsoplasty. I leave them in the belt, the back part, at the belly button, and on the drain. But those stitches are not the ones responsible on holding your skin together. They're just like just in case you get a little bit of opening, doesn't get worse. But the main ones, the ones that are really putting everything together, are inside your body, and they're absorbable. Okay?
How long does it take for those internal stitches to absorb?
Weeks, a lot, like 6, 8 months. Depends of the material.
Mm-hmm.
But that's why that's why people think that everything. No, initially the sutures only place the skin together, and then your body, when it's healing, it helps. It makes like the final sticking the two ends of your body together, and then the stitches just begin to reabsorb in a rate that lets your body heal first, and then they reabsorb.
Gotcha. Now, let's talk about cost and pricing. A lot of people think plastic surgery and they hear all these procedures and they're probably thinking it is unobtainable. It's just going to be astronomically crazy price. And in theory, in the US, like the pricing is wild. But in Mexico, it's a lot more affordable, correct?
Yes, it's just country-wise, and the medical system is different.
Mm-hmm.
Also in Canada, it's incredible that just for one procedure, you're gonna pay what we do for 5 or 4. I don't know,
Yeah.
and it is astronomical for you guys, especially if you live in the U.S. and Canada. Here, because we're medical tourism, we can the prices are very affordable. They're not like unreachable. You can save your money and also come here and do everything. You just have to put your mind to it. I do advise that when even if anybody does it or I do it or go to another country and go and have surgery, always think about extra money for unexpected like expenses. Okay,
Yeah.
foreseen expenses. You always have to have money. You can go to any other country, have surgery, and expect that 100% of the time everything is going to go well. You know, you always have to, like, for blood transfusions in case you lost a lot of blood in the procedure because just that's the way your body is or whatever that you were bleeding. You need to have a little bit of extra money for unforeseen expenses.
Yeah, and I think that goes for no matter where you have surgery, even if you're staying in the States or Canada or staying in your hometown to have surgery, you always have to have, a just in case fund because,
Have to.
Yeah.
You I mean, to travel to another country just for fun or tourism.
Yeah.
You cannot go without money because or a little bit of extra money just in case something happens. You know.
That's life. Even if you're
Yes.
not traveling.
No, but that's what the page is for. You have to be
Yeah.
prepared for everything.
Yeah, exactly. So what is like the biggest difference in the medical system between, let's just say, the US and Canada versus Mexico?
That here we're more free to do a lot of stuff. In the United States and Canada, your hands are very tight because it's an insurance system. Also, you have to be aware of all the lawsuits. It's difficult. It's very different.
Yeah.
No, here in Mexico, the doctor it's not guilty. I don't know how to say it until you prove otherwise. In the United States and Canada, you go directly to the doctor and you blame it all to the doctor. So it's a defensive medicine. You know, you have to be all the time like trying to watch your back because your reputation and your license can be very like under jeopardy. But here we do everything by the norm, by the rule. But thank God we're in a health system that lets us a little bit more to be free.
Yeah.
I don't know how to explain.
No, that's perfect. We were talking to co-founder Michelle a few episodes ago, actually the first episode, and she explained it really well. She was saying that in like the US and Canada, there's so many middlemen in between, the patient and the surgeon. So, but in Mexico, there's just really not that whole middle ground. So, and that's another reason why surgeries can be cheaper because you just cut out all that,
Oh yeah,
middle ground.
because you need, for example, to draw blood, you need a phlebotomist. To do this, you need this. To do that, and there's a lot of people involved just to like here. One person can do a lot of stuff.
Yeah.
Well, maybe that's the way they handle it. I don't know.
Yeah. No worries.
For example, I can do whatever. I can draw blood. I can do an IV. I can do a lot of stuff.
I think that's circling back because you guys become general surgeons first, and you have a lot more
just
medical.
Being a doctor, you have to know to do all this stuff.
That's what I was going to say. You have a lot more, stuff that you guys have to go through to become who you are versus just jumping straight to that. Okay, excellent. Well, thank you for your time, Dr. Lazos. Is there anything else that you think is really important that people should know before coming to Mexico or researching plastic surgery?
No, that's it. Reach your BMI goal. Read all the pre-op instructions and do your research at the face group support groups.
Yep.
Almost all my patients have waited 1 to 2 years. Thank you so much for that, for waiting. I have really, really appreciated it. But it's because they've done the research and you have a lot of time to prepare for your big day.
Yeah.
And I hope that it's very as wonderful and worth waiting that we are willing to do the best for you in your surgery.
Excellent. Well, thank you so much. And you guys, thank you for joining us on another episode of Bariatrics and Beyond. As you can see, you have a lot to look forward to after losing the weight. You can go visit our magic hands, Mr. Dr. Omar Lazos, and he will get that body going.
Say something. I didn't name myself Dr. Magic Hands. I swear to God, it was very funny because they started to like calling me that, and that's how it just sticked in. But I didn't name myself like that. Okay,
You
guys did.
Yeah, we did it. Well, because you do have magic hands, and you have a really cool pillow that says magic hands.
Yeah, I know. You just have to love what you do. It's as simple as that.
Yeah.
And if you're going to do something, you have to do it the best you can, always, for everybody.
If you weren't a plastic surgeon, what would you think you would do?
A chef.
Right.
But I will be doing bypass right now.
That's funny. You're hilarious. All right. Well, thank you, Dr. Lazos. You have a good afternoon. And as always, you guys will see you next week on Bariatrics and Beyond, where we're actually going to be having some past patients here in the studio for a special Halloween edition. So stay tuned. Bye, you guys.
Bye.